Today, we are going to be talking about specific risk factors for respiratory illnesses, and we're joined by Dr. Rihanna Jumamil, and she is going to be speaking with us specifically about risks that are associated if you have HIV, obesity, or diabetes.
My name is Dr. Jumamil. I'm a doctor in internal medicine and a preventive medicine resident at Mount Sinai. And today we're going to be talking about risk factors for respiratory illness. So these are our learning objectives. First, I'd like to describe risk factors for lung disease. In other words, talking about how certain health conditions can make it easier to get sick with things like colds, the flu, or other respiratory illnesses. And then I'd like to relate good practices to prevent disease. And then finally, identify what are the recommended vaccines for respiratory illnesses and to prevent them. The first risk factor we'll talk about is obesity. And just to give the definition of obesity, it is based on the body mass index or BMI. This is a calculation based on weight in kilograms and height in meters. And it doesn't measure body fat directly, but it is associated with other measures of body fat. So when you go to the doctors, usually they will calculate your BMI based on your height and weight. And what is considered obesity is a BMI of 30 and greater. So in class 1 obesity, that number is between 30 and 34.9. Class 2 is between 35 and 39.9, and class 3 is 40 or over. Just so you know, what does it actually mean? But as we all know it, it means having a high number and high percentage of body fat, and it can overall generally make moving around and breathing much harder. Other ways that people can define obesity is measuring your waist circumference. So how many inches on your waist? A waist circumference of 40 inches or more for men and 35 inches or more for women is associated or, related to having more health complications. And similarly, people, talk about apple versus pear-shaped. So for folks who tend to be more apple-shaped, have a higher waist circumference, which can be associated or again related to more health complications. So how does obesity relate to lung disease or, other lung illnesses? Well, we know that obesity is related to asthma, obstructive sleep apnea, obesity hypoventilation syndrome, and different immunity effects. So let's go through each one by one. So for asthma, the way that works is that the extra additional fat and body mass can press on the lungs, making it much harder to breathe. So as a result, people with obesity might have, weaker lungs. In addition, people with obesity have a lower immune system function, so the parts of your body that is working to prevent disease. And as a result, it can be easier to have more asthma attacks. And that can be due to inflammation of your airways. Obstructive sleep apnea, that happens when, say, you're sleeping and in the middle of your sleep, you suddenly stop breathing. That's obstructive sleep apnea. The reason why that happens is, again, compression of the lungs, but when you're sleeping, the tongue or having, a large neck mass can also compress and block the airways. A person can stop breathing in their sleep because of that blocked airway by the tongue or the neck. Similarly, in obesity hypoventilation syndrome, that's again related to compression of the lungs by body mass or having too much abdominal fat. That can flatten your diaphragm, which is the muscle that helps you breathe. And as a result, people with obesity oftentimes breathe slower and can't breathe as more effectively. And just in general, there is increased inflammation with extra fat cells and decreased or lower immunity, which can make it easier for folks to get infections like the flu, or bronchitis. The next risk factor I wanted to talk about is diabetes, which is often related to obesity because having a very large percentage of fat can increase your risk for diabetes. So what is diabetes? It is when there is too much sugar in the blood and the body can't use the sugar properly for energy. In a normal state without diabetes, this yellow slivery thing is the pancreas. The pancreas produces a hormone called insulin, which helps the body bring in glucose or sugar into the cells in order to be used for energy. But in type 2 diabetes, the body doesn't respond to insulin. It's resistant to insulin. So the blood sugars can't get absorbed and used by the body's tissues. And as a result in high blood sugar. And that's what people are typically familiar with when they check the blood. That blood test is checking how high of a sugar level there is. So how does this relate to lung diseases? Well, high blood sugar in general can damage the body's organs, and it can weaken the immune system, making it hard to fight off germs. Therefore, people with diabetes can get sick with colds, the flu, or pneumonia more easily. In addition, other non-infectious issues that can happen is asthma. There's an increased risk for asthma. There's also an increased risk for developing COPD. COPD stands for chronic obstructive pulmonary disease, which is also common in people who smoke. And just generally, diabetes can damage the lungs in general through the blood vessels that go to the lungs. And there is also an association or relationship with lung cancer in folks with diabetes. The last risk factor I wanted to talk about is HIV, which stands for human immunodeficiency virus. Basically, HIV is a virus that attacks the immune system, or the cells that help the body fight infection. So if someone has HIV, it's a lot harder for their body to stay healthy because their immune system is very weak. So it's a lot easier to get infections. And we often see infections that are really rare because we just don't typically see that in someone with a functioning immune system. So we know that there's no cure right now for HIV, but it is very treatable with medications. And I'll go into how it affects respiratory illness, but some of the symptoms that HIV can cause are mouth sores, fatigue, having a sore throat, which is also common in a lot of colds and flu, diarrhea, night sweats, muscle aches, rash, fever and chills, and swollen lymph nodes. Because HIV lowers the immune system, again, it can't fight off germs as well. And that means they can catch colds, the flu, and pneumonia. So under infectious causes, there's bacterial pneumonia. So these are pneumonias that can be treated with antibiotics because they are caused by bacteria. And what happens in pneumonia is that in the lungs, there are these little air sacs that comprise the lungs, and they can sometimes get filled with inflammatory cells and fluid. And of course, that is from the bacteria that is growing there. And in people with HIV, we can often see something called pneumocystis pneumonia, which is a rare type of pneumonia that will often need hospitalization for extra strong antibiotics. Other things that we can see are viral pneumonia, which are pneumonias caused by viruses. The most famous, which you might know, is COVID-19, right? That is a type of virus. It cannot be treated by antibiotics, but other ones you might hear of are RSV, right? And influenza. These are types of viruses. And then another type of infectious lung disease is tuberculosis. And HIV is also associated with other non-infectious causes. So it can increase the risk for lung cancer, Hodgkin's lymphoma, which is a type of cancer, constrictive bronchiolitis, which is constriction and inflammation of your airways. It's similar to asthma, bronchiectasis as well, and emphysema. So that's basically damage to the lung tissue themselves. And bronchiectasis is damage to the airways themselves. How can we protect ourselves? So this is from the CDC. They have a lot of helpful guidance in how to protect yourself from respiratory illnesses, especially if you have some of these health conditions that can put you at higher risk. So, of course, one of the core strategies, which I'll talk about shortly, is immunizations, or what vaccines can you get to lower your risk for infectious diseases. Hygiene is going to be really important, and that includes making sure that you wash your hands, especially after, blowing your nose or, touching public surfaces, and then steps for cleaner air. So basically, if you're someone with asthma, for example, maybe having an air purifier near the window can be helpful to reduce a lot of the allergens and the pollens and potentially some viruses. Getting treatment if needed for bacterial infections, especially. And of course, if you feel unwell, it's going to be very important to stay home to prevent spread. And also for yourself, you want to be able to stay home to treat yourself and make sure your symptoms are getting better and that you don't have any fever. And the CDC, says to take, precaution over the next 5 days after feeling better. Additional strategies, which we know can work, is of course masking, because that's how a lot of these respiratory illnesses spread, like when we sneeze, when we talk. So having a mask provides that additional barrier. Distancing yourself, and of course testing. In this case, the COVID rapid tests are very helpful to have, just so if it is COVID, then all the more reason to stay at home, because COVID can spread very easily, and you would be protecting both yourself and others who may potentially be at higher risk for getting these diseases. So I wanted to talk about some important vaccines that we recommend, especially for folks with HIV, obesity, or diabetes, which again can increase your risk, not just for having a lot of these illnesses, but having it be worse, having worse outcomes with them compared to, folks who don't have those health conditions. So for the flu vaccine, it's recommended that everyone 6 months and older get the flu vaccine once a year. People may say, oh, like it's not very accurate anyway. And it is true that it's hard for scientists to predict 100% what the flu will look like, but generally it's recommended because some protection is better than, zero protection at all, especially since we know some folks who get the flu do end up in the hospital, which is way worse than just getting the vaccine. The COVID-19 vaccine, have been a lot of updates. So for folks who are unvaccinated, you just need one updated Pfizer or Moderna vaccine to be considered vaccinated. If you have been vaccinated before, for people between 5 and 64 years, you're up to date when you received one of the updated vaccine doses. So just getting a booster of the latest one that came out between 23 and 24. And then for age 65 and older, because older folk are at higher risk for worse outcomes, you're up to date when you receive 2 vaccines of the most recent booster. And then pneumonia, this vaccine is against one of the more common causes of bacteria that causes pneumonia. For people between 19 and 64 years old and are immunocompromised, that means they have one of the risk factors that lowers your immune system, you can get the pneumonia vaccine. And there are different kinds. So when you go to the doctor's office, they will let you know which one is best for you. And it's also recommended for adults 65 and over. And then finally, we have the RSV vaccine, which, if you haven't heard about, just came out last summer for two groups of people. So the first is for pregnant people who are 32 to 36 weeks pregnant. And it's recommended that they get one dose during RSV season, which is, during the fall and winter months. And then another group of folks are adults 60 years and older. And it's found to also significantly reduce RSV infections and hospitalizations as well.